Welcome back, everybody. We continue with our talks on the 2021 fiscal year budget, and now we're going to be speaking on the topic of health. With me this morning is Dr. Angele Mark, who is the House Officer of the Southwest Regional Health Authority, also telemedicine, GP consultant, and MedLink. Good morning, Doctor.
Hi, good morning, Carrie. Good morning, Trinidad. It's a pleasure to be with you guys again.
And thank you for joining us again this morning. It's great to be chatting with you. Now, the Minister of Finance has allotted 6.05 billion just about for health. What are your views on this allotment?
Okay, so that budget, that allocation that health received, we saw that it's been mainly for recurrent expenditures, maintenance of existing programs, continued infrastructural upgrades, etc.
Right.
We would like to see with the Central Block, Port of Spain General Hospital, who lost their Central Block in 2018. I think, however, though, even prior to the pandemic, but now so in the pandemic, there's an urgent need for health education. And how are we going to go about that, right?
Right.
The best place to start is in our schools. I mean, we see yearly education and training programs being given the highest allocations, a $50 million stimulus package for laptops to deal with the pandemic constraints and having students have access to their online learning. But when are we going to really make mandatory health and wellness as a subject in schools? And I'm not just talking about physical education.
Right.
We think of health education in the aspect of visiting a GP office or your primary care physicians, or being in a hospital, a doctor or health professional educating you. But I think it's absolutely necessary now that we have a subject that alludes to food and agriculture, sex education, and just general health education for the young people, because that's the way to make it permanent, right?
Right. You know, sorry, you go on.
Yes, additionally, we need to be investing more into research and technology in the health sector, because that's going to be the way to move forward. We're in a situation now where we are in a pandemic and we are pretty much awaiting an international import for a vaccine, when funding needs to be given to our scientists so that they are able to create that. Because God forbid this happens again.
Right.
What are we going to do, right?
Now, with this allotment, do you think that it is enough to meet the current demand for, healthcare in the country, as well as the additional demands put on the country by COVID-19?
So I think that allotment is truly for maintenance. As I said, the topics that I brought up about health education and the things that we need to do for research and technology in health, I think that's a big gap that we are having, and a huge challenge we are facing in the healthcare system. So I think, last year was just a $5.6 billion allocation. So this is just a small jump. I'm not too sure how far we'll be able to get there, but I'm hoping that the cries of our healthcare professionals and just the general public, because I think they are at a place as well where they understand the correlation of food and agriculture and the progress it will make in terms of disease prevention.
Now, you mentioned technology, and I know that the various health authorities have done some work as pertains to developing apps and putting other things, digitizing health services to some degree. What do you believe can be done to help bolster this move?
Right. So I was discussing in my interview yesterday with you guys the implementation of telemedicine in the public health sector. Now, I have been doing that privately just as of 2020, obviously, because there's a great need for us to keep in touch with our patients amidst the pandemic, but also keep them safe. So I think there's a huge learning curve in terms of that, but I don't think it's possible, right? The people in authority, I think they're at a place where they need to challenge themselves and implement these changes, educate the population on how we can probably go about achieving something like this within the next couple of years, because technology in all sectors are really the way to move forward, right?
Yeah, definitely. And, with technology, there are pros and there are cons. But let's focus on the pros a little bit. A thing that you were focusing a lot in this conversation is the education. So can we pair education and technology in some way to help, at a lower cost, push forward the agenda of getting more health education and wellness education out there?
Well, absolutely, because I mean, now we're in a situation where our primary and secondary schoolers, they are using computers to go to school every day. This is actually the only avenue we have to educate them. So it's a matter of our teachers, our principals, minister of education, putting that sort of mandatory subject into the curriculum, so that, yeah, once a week, twice a week, they are given this allocated time to be educated on how to go about disease prevention, what are the different things affecting children and even adults, because our children are intelligent, you teach them and they learn, right?
Right.
So I think there's definitely space for that, and we can probably look forward to that in 2021.
And let's speak a little bit of the recurring costs. There are certain programs such as CDAP that benefit a number of people, as is in the budget statement, as the finance minister was reading out yesterday. What do you think about the maintenance of programs like that, and even increasing programs that for the social welfare of the country as pertains to health?
Right. So the CDAP has done a lot in terms of helping patients access their medication. I think it's definitely a program that benefited so many people throughout the country. There's room for maybe additional medication to be available on the CDAP, because it's not a very wide range. Just repeat your second question.
The question, so speaking, what do you believe, how do you believe the budget helps to support programs as such, and, and what more can be done as pertains to programs like the CDAP and the budget?
Right, so the CDAP, as I was saying, is more of maintenance. So we're gonna see CDAP being continued moving forward, but that's a situation of maintenance, right? I think the budget can continue to uphold its end for the financially supplying medications through the CDAP program, and I think that's a plus, so the patients are able to access it. Mm-hmm.
I want to ask you a question. So if you were the person in the seat that had to manage the allotment of the budget, or even be the one to allot the budget to the sector, what would you do? How would you spend the money?
Right. So I think I'd definitely allot a little bit more, and this will be a sort of joint situation with food and agriculture, health, and education, because I think that's really where we'd like to bridge the gap. This is not solely a health problem. It's not solely an education problem or food and agriculture problem. Having these three sectors together is really how we would be able to achieve this. So that would mean allotment from all three sectors, right?
Yeah, it definitely would, and I like the thought process there of putting linkages between the three sectors, and having an overall benefit and allotment going toward that. But with that, this is all we do have time for this morning. So I want to thank you so much, Dr. Angele Mark, for joining us this morning.
Thank you so much, Carrie.
All right, so that was Dr. Angele Mark, who's the House Officer of the Southwest Regional Health Authority, also telemedicine GP consultant and MedLink.